Let's talk about the coronavirus and the workplace. What is your HR plan? You can turn on any television or read any newspaper or go on social media, and all the talk is about the coronavirus. And some people are scared out of their wits, and some are saying, what's the big deal about something that is supposed to be as common as a common cold? Well, listen, I'm Melva Tate. I'm the owner of Tate and Associates. We're a leadership consulting firm, and we specialize in human resource management and career development. And I have the awesome opportunity to work with organizations all across the U.S., whether that's professional sports teams, municipalities, state agencies, colleges and universities, manufacturing facilities, or nonprofits on how they move their mission forward through the talent that has been assembled. I really like to say that we help cultivate people and the places that they work. So I want to spend a little bit of time putting together this presentation to talk about the coronavirus and how its impact or how it has already impacted our workplace and what is our HR plan. So clients have called. I've been around a couple of HR professionals who have talked about it. I know that generally we try to be more proactive than reactive when we hear of issues like this. And then, of course, as I've already said, there's tons of news about it. Some is pretty accurate and spot on. Some of the information you may receive is incomplete, and some of it is just downright false. So I'm going to share with you some of those discussions and information that I've been able to find about the coronavirus. Let's talk about the concern. Most experts in the medical industry have talked about it's not a matter of if, but when the coronavirus will strike the US. And they have all said it is best to prepare, but not overreact. But let's be realistic. There have been over 80,000 confirmed cases of the coronavirus. And it has also spread to every continent except Antarctica. So if you're in Antarctica, you're okay for right now. But even it has dispelled some of the myths that it cannot be transmitted in warm weather climates like Brazil, which has experienced its first case. There's also a major concern for our U.S. military who are serving overseas with the first diagnosis of a military person stationed abroad. And of course, if you've read any news about it, you know the U.S. Department of State has issued a do not travel advisory for China. And many of the airlines in the industry have cut back or either canceled flights to China. And now others are being added to the list. So if you think about what we're dealing with the coronavirus, think back in 2014 or 2016 when we dealt with cases of the Ebola virus and those recommendations that were suggested then. So the what? What is the coronavirus? I had to do some research myself. But first of all, the CDC has said that a pandemic is defined as a disease that spreads easily from person to person. Now, they have said that the coronavirus has met two of the criteria for a pandemic and is moving closer to meeting the third criteria. And that third criteria is worldwide spread. So, how does this virus spread? Well, it's a respiratory virus. And if you cough or if you sneeze, you have the possibility of depositing droplets that could be attached to others and give them the virus. From what I understand in the research that I've heard, it is most critical to those who are elderly or who have a chronic disease. And oftentimes, people who have come down with the coronavirus will describe the initial symptoms as feeling like a common cold. So the CDC has said the symptoms include a fever, a cough, shortness of breath, and then difficulty in breathing. The reason why it's so much concern and not necessarily panic right now is because there is no vaccine for the coronavirus. So think of it this way. If someone comes down the stages that they've diagnosed, people are mild, moderate, and then severe. So if you think about mild, it's like having a common cold, the sneezing, the coughing, a little bit of the fatigue. More moderate cases of the coronavirus will show up in the form like a flu, where the person may have some body aches, maybe some diarrhea, shortness of breath, and then even the fever. And then the most severe cases where people are really hospitalized is cases like pneumonia, where they really struggle to breathe. And from what I understand, most of the people who've died have died from symptoms very similar to pneumonia. So that's what we understand so far in my non-medical terms of what the coronavirus is. So what can we do in our workforce? What can we do to prepare for the coronavirus or even streamline some of the symptoms and signs and things in our environment that we can control? So I've got, in talking with individuals, there are a couple of tips that have been shared. Most of them are pretty common sense and things that you may already be doing in your workplace. And then some of them may give you some food for thought. Again, the coronavirus and the symptoms that we see are and the way that they show up in individuals and the procedures that we take to prevent it is much like we do with the common flu or the seasonal flu that comes around. People are getting flu shots and preparing, and you hear the terms about washing your hands. So one of the tips that one of my HR pros said, they have put out messages and email messages and all around reminders for people to simply wash their hands. Now, it sounds very basic, but you'd be amazed at the number of people that I have encountered in public spaces that do not wash their hands or do very nasty things and touching their face or nose and then touching other surfaces. So encouraging people, reminding people to wash their hands frequently is number one. Putting out more signs about it. Covering your mouth when you cough. Even though you may not have the coronavirus, again, this is a way to minimize spreading germs in a public environment like a workplace. Putting hand sanitizer in numerous locations. Everybody should have a bottle of hand sanitizer on their desk. It should be in common areas like the restroom and break rooms and conference rooms. In addition to having hand sanitizer around, get a couple of cans of Lysol. In every place that there is a bottle of hand sanitizer, there should be a can of Lysol, and people should not be afraid to use it. And then there are some basic workplace etiquette or wellness strategies that you should already be encouraging your team to do. The number one is stay home if you feel sick. Stay home. That's how common colds are spread, flu is spread, and certainly the coronavirus can be spread. If you are sick, stay home. There was a recent survey that was conducted, and it said that 90% of employees go to the office even if they don't feel well. 90%. That's a huge number. So if you start out reminding your employees of your wellness policy and plans and encouraging them to stay home would be a great idea. At this point, I would recommend having a flash meeting or a very short meeting to communicate your plans, your policies, and procedures around your workplace wellness plans, including stay home if you don't feel good. And then I would also encourage you, if issues were to rise based on your industry, then you probably need to review or even create some telework options for individuals to work remotely or work from home so that it does not create a major disruption in your workforce. So giving individuals the ability to work from home. Another thing that you may want to consider, if you have individuals who are traveling for business or for leisure, and especially if it is international travel, because even if they're not going through a hot spot, They may be going through the airport where international travelers travel. So maybe allowing or putting in place some type of 14-day quarantine. You may not want to call it a quarantine, but a 14-day space between them coming back into the office just to make sure that they're okay and allowing them to work from home. One other thing that you should probably do is review your crisis plan for any type of work disruptions. Some industries are already impacted by the coronavirus, technology industries, certainly the travel industries. So it may be that you just look at if there's a need to lay people off even temporarily while this issue is being undertaken. And then provide frequent and valid information to your staff. So whether that is once a week or every 10 days, something is going out about your plan, your reminders about those most critical things that you want your staff to do. And then last but not least, ensure that there's no discrimination going on in your workplace. Earlier this month, we heard about how individuals were treated, particularly individuals of Asian descent, who were being ridiculed and had very abusive comments made to them because people automatically suspected just because they were Asian that they could possibly carry the virus. And this is nothing but sheer stupidity. So you want to make sure that there is no discrimination going on in your workplace, particularly around the areas of Title VII, which is the Civil Rights Act, and also under ADA. So companies should make sure any of their Asian origin employees, whether they are directly from the country, if it's an international company that have individuals from the home country working there. We have a lot of manufacturing facilities. I'm based out of Alabama, and we have Honda here. We also have Mercedes here. We have Hyundai here. And so there are a large number of automotive manufacturers and third tier manufacturers who support those organizations who have individuals who are from um, China or maybe from Asia or maybe of Asian descent. So making sure that those things are not happening and that you put a stop to it, but not just waiting until you have your first occurrence, but then reminding your team that it is discrimination to make insensitive and rude comments to someone based on what's going on with the coronavirus and their ethnicity. And last but not least, I want you to do your research. You need to research and get up to speed on what's going on and how it may impact your organization. So do your research. The CDC.com, has tons and tons and tons of information that's out there. I think it's CDC.com. It could be .org or .gov, but the CDC definitely has tons of information. And then also, if you're an HR professional and you're listening to this, if you're a member of SHRM, the Society of Human Resource Management, SHRM is building a platform to share information, up-to-date information and articles with HR professionals as we continue to try to find out more about the coronavirus and its impact on the U.S. and also U.S. workforces. And that is it. So listen, I just tried to share with you things that I thought in this quick 15-minute presentation. And I hope that it has been of value to you. Most importantly, I am not a health expert. I'm an HR guru, but I just shared with you things that I have researched and discovered and things that have been shared with me. But I would say do your research as well. Again, this is your girl, Melva Tate, the success coach, and I hope that you have found this information valuable. Y'all be safe out there. And most importantly, do nothing. If you don't do anything with this information I've shared, wash your hands. Bye.